Praise be to Allah, the cherisher and sustainer of the worlds. I'm Dr. Ramsha Mushtaq Khan, and today I have the opportunity to present on the topic lead poisoning and occupational cancers under the kind supervision of Professor Dr. Saira Afzal. Quote of the day: all things are poison and nothing without poison. Only the dose makes that a thing is no poison. Content outline. Number 1, lead poisoning. Its sources of lead exposure, symptoms of poisoning, health effects and prevention and control measures. Number 2, occupational cancers, types of occupational cancers, common causes, symptoms, and health effects and prevention and control measures, and recent advances and multiple choice questions. At the end of this presentation, the participants will be able to understand the sources and pathways of lead exposure in the occupational setting and identify the health effects associated with lead exposure, including acute and chronic toxicity, recognize the importance of primary prevention measures in reducing lead exposure, understand the impact of occupational exposures on the development of cancer and the importance of monitoring and managing exposure to carcinogens in the workplace, and recognize the global recent advances in this context. Lead poisoning. More industrial workers are exposed to lead than any other toxic metal. Lead is used widely in a variety of industries because of its properties like low boiling point, mixing with other metals easily to form alloys, easy oxidation, and anti-corrosive nature. These are the compounds of lead: lead arsenate, lead oxide, lead carbonate, lead sulfide, and lead acetate. Toxicity of lead compounds. All lead compounds are toxic. Most toxics are lead arsenate, lead oxide, and lead carbonate, and least toxic is lead sulfide. Sources of lead. Lead is one of the few trace metals that is abundantly present in the environment. The greatest source of environmental non-occupational lead is gasoline. Thousands of tons of lead every year is exhausted from automobiles. Lead exposure may also occur through drinking water from lead pipes, chewing lead paint on windowsills or on toys in case of children. There is a potential for lead exposure in several common occupations and products that are used in nearly every household. The occupational sources include battery work, mining, glass manufacturing, automobile repair, ceramic work, painting, pottery, smelting, printing work, plumbing, soldering, and making lead pipes and plastics. And non-occupational sources include traditional medicine, vehicular exhaust, contaminated cosmetics and sindoor, household storage batteries, household paints, contaminated spices, effluent from lead-based industries, contaminated soil, dust, and water near lead-based industries, food grown in lead-contaminated areas, retained bullets, food stored or cooked in lead-coated vessels, and painted toys. Modes of absorption. Lead poisoning may occur in 3 ways. Number 1, inhalation, fumes and dust of lead or its compounds. Ingestion in food or drink through contaminated hands, or dermal or via skin. Only organic compounds of lead, especially tetraethyl lead, is involved in dermal transmission. The body store of lead in the average adult population is about 150 to 400 milligrams, and blood vessels average about 25 micrograms per 100 ml. An increase to 70 micrograms per 100 ml blood level is generally associated with clinical symptoms. Normal adults ingest about 0.2 to 0.3 milligrams of lead per day, largely from food and beverages. Distribution in body. 90% of the ingested lead is excreted in the feces. Lead absorbed from the gut enters the circulation, and 95% enters the erythrocytes. It is then transported to the liver and kidneys and is finally transported to the bones, where it is laid down with other minerals. Although bone lead is thought to be metabolically inactive, it may be released to the soft tissues again under the conditions of bone resorption. Clinical picture. The clinical picture of lead poisoning or plumbism is different in the inorganic and organic lead exposures. The toxic effects of inorganic lead exposures are abdominal colic, obstinate constipation, loss of appetite, blue line on the gums, stippling of red cells, anemia, wrist drop, and foot drop. whereas the toxic effects of organic lead compounds are mostly on the central nervous system and include insomnia, headache, mental confusion, and delirium. Diagnosis of lead poisoning is based on history of lead exposure, clinical features, that is loss of appetite, intestinal colic, persistent headache, weakness, abdominal cramps and constipation, joint and muscular pains, the blue line on gums and anemia, and laboratory tests, which include coproporphyrin in urine, CPU. Measurement of CPU is a useful screening test. In non-exposed person, it is less than 150 micrograms per liter. Aminolevulinic acid in urine, if it exceeds 5 milligrams per liter, it indicates clearly lead absorption. Lead in blood and urine. Lead in urine of over 0.8 milligrams per liter, normal is 0.2 to 0.8 milligrams, indicates lead exposure and lead absorption. A blood level of 70 micrograms per 100 ml is associated with clinical symptoms. Basophilic stippling of RBCs, it is a sensitive parameter of the hematological response. Blood lead levels associated with adverse health effects. Here in children and adults, the blood lead levels of 10 micrograms per deciliter is indicative of developmental toxicity, decreased IQ, decreased hearing, and decreased growth. Vitamin D metabolism is decreased nerve conduction velocity at 20 micrograms per deciliter. Vitamin D metabolism is further decreased, and in adults, elevated blood pressure, increased erythrocyte protoporphyrin at 40 micrograms per deciliter, decreased nerve conduction velocity, and ultimately at 150 micrograms per liter, death in children and encephalopathy or nephropathy in adults. Preventive measures. Number one is substitution, that is where possible, lead compounds should be substituted by less toxic materials. Number two is isolation. All processes which give rise to a harmful concentration of lead, dust, or fumes should be enclosed or segregated. Local exhaust ventilation. There should be an adequate local exhaust ventilation system to remove fumes and dust promptly. Number four is personal protection. Workers should be protected by approved respirators. Number five, good housekeeping. Good housekeeping is essential where lead dust is present. Working atmosphere. Lead concentration in the working atmosphere should be kept below 2.0 milligrams per 10 cubic meters of air, which is usually the permissible limit or the threshold value. And number seven is periodic examination, which includes the medical examination and as well as the laboratory determination of urinary lead, blood lead, red cell count, hemoglobin estimation, and coproporphyrin test. Personal hygiene, there should be adequate washing facilities in the industry. Prohibition on taking food in the workplace is essential. And health education, workers should be educated on the risks involved and the personal protection measures. Management. The major objectives of the management of lead poisoning include the prevention of further absorption of lead, the removal of lead from soft tissues, and prevention of recurrence. Early recognition of cases will help in removing them from further exposure. A saline purge will remove unabsorbed lead from the gut. Antidote. The use of D-penicillamine has been reported to be effective, like calcium EDTA. It is a chelating agent and works by promoting lead excretion in urine. Lead poisoning is a notifiable and compensable disease in and around the world. Occupational cancers. Skin cancer. The first to draw attention to the occupational hazards was the cancer of the scrotum in the chimney sweeps in 1775. It was subsequently found that cancer of the scrotum and of the skin in other parts of the body was caused by coal tar, X-rays, and certain oils and dyes. Statistics show that nearly 75% of occupational cancers are skin cancers. Skin cancers are an occupational hazard among gas workers, coke oven workers, tar distillers, oil refiners, dye stuff makers, road makers, and in industries associated with the use of mineral oil, pitch, tar, and other related compounds. Lung cancer. Lung cancer is a hazard in gas industry, the asbestos industry, nickel and chromium work, arsenic roasting plants, and in the mining of radioactive substances, for example, uranium. Nickel chromates, asbestos, coal tar, radioactive substances, and cigarette smoking are proved carcinogens for the lungs. Arsenic, beryllium, and isopropyl are suspected carcinogens. More than 9/10 of lung cancer are attributed to tobacco smoking, air pollution, and occupational exposure. Bladder cancer. Bladder cancer was first noted in men in the aniline industry. In more recent years, it was noted in the rubber industry. It is now known that cancer bladder is caused by aromatic amines, which are metabolized in the body and excreted in the urine. The industries associated with cancer bladder are the dyestuffs and dyeing industry, rubber, gas, and the electric cable industries. The following have been mentioned as possible bladder carcinogens, which include beta-naphthylamines, benzidine, para-aminodiphenyloramine, and magenta. Blood cancer. Exposure to benzol, Roentgen rays, and radioactive substances give rise to leukemia. Benzol is a dangerous chemical and is used as a solvent in many industries. Leukemia may appear long after exposure has ceased, about 20 to 30 years. Control of industrial cancers. The control measures comprise the following. Number 1, elimination or control of industrial carcinogens. Number 2, medical examinations. Number 3, inspection of factories. Number 4, notification. Number 5, licensing of establishments. Number 6, personal hygiene measures. Number 7, education of workers and management. And number 8, research. Now the recent updates. This is the World Health Organization Chemicals Roadmap. The roadmap to enhance health sector engagement in the strategic approach to international chemicals management towards the 2020 goal and beyond. It includes 4 action areas. Number 1 is risk reduction. Number 2 is knowledge and evidence. Number 3 is institutional capacity. And number 4 is leadership and coordination. Risk reduction includes health protection strategies, healthy healthcare settings, raising awareness. Knowledge and evidence include risk assessment, biomonitoring and surveillance, measuring progress, and sharing and collaborating. Institutional capacity includes national policy and regulatory frameworks, international health regulations, and training and education. Leadership and coordination includes health in all chemical policies, health sector engagement and coordination, and engagement with other sectors and stakeholders. The overall objective of the strategic approach is to achieve the sound management of chemicals throughout their life cycle so that by 2020, chemicals are used and produced in ways that lead to the minimization of significant adverse effects on human health and the environment. 2030 Agenda for Sustainable Development, achieving the sound management of chemicals throughout their life, is a cross-cutting issue that will contribute to achieving many, if not all, 17 Sustainable Development Goals. The targets below are only those that specifically mention chemicals, that is Goal 3, Target 3.9, Goal 6, Target 6.3, and Goal 12, Target 12.4. Occupational cancer, a hidden reality and an awaiting challenge. This is the article from Spain. Due to its incidence and prevalence as well as its mortality, cancer is one of the biggest challenges faced by the medical community. If we look at the most recent figures, the number of new cancer diagnoses worldwide amounted to 18.1 million in 2018. These data consolidate an upward trend that, according to estimates, would draw a scenario of approximately 30 million people affected by cancer in 2040. However, in recent decades, remarkable efforts in societies like Spain seem to have translated into a significant decrease in the death rate from this cause. Thus, in countries such as the United Kingdom, it is estimated that the survival rate has doubled compared to 40 years ago. And in Spain, the overall survival at 5 years currently reaches figures around 53%. The interventions that have allowed these great advances have taken place mainly on 3 fronts. Number 1 is early diagnosis. Number 2, improvements in the therapeutic arsenal. And number 3 is the identification of preventable risk factors. As in the figure, the causes of death in Spain in 2018 are shown, and the maximum number is for the occupational cancer. The answer to the major challenge of occupational cancer and its detection requires the collaboration of all the professionals and institutions involved. In country like Spain, this collaboration is more necessary, if possible, to occupy one of the last positions in Europe regarding the reporting of this pathology. Within the complex network of occupational cancer detection, one of the most valuable assets is the doctor. Making his or her collaboration possible implies providing resources from different perspectives, which is still a pending issue in their country. All this currently draws a scenario that can be extensively improved if the involvement of this professional in reporting the suspected occupational pathology is intended. History shows that the damage that a poor response to an occupational carcinogen can cause, society has ultimately placed in the hands of the medical professionals the responsibility and the possibility to prevent cases such as asbestos from recurring. To do this, the invisible must first be made visible, so that the diagnosis of the occupational cancer ceases to be a rare occurrence and begins to become a reality. Now it's time for the multiple choice questions. Number 1, a mother of 2 young children, ages 3 and 6 years, living in an old house, notices complaints of frequent headaches and stomach aches in her children. The primary source of lead exposure in her children might be number A, inhalation of lead dust from lead-based paint, B, drinking water from lead pipes, C, ingestion of lead-contaminated food, D, inhalation of lead dust from soil, and E, inhalation of lead dust from lead-based toys. Anyone?
A.
Yes, the answer is A, inhalation of lead dust from lead-based paint. Number 2, a concerned mother brings her 5-year-old son to the pediatrician for a routine checkup. Of the following, one most common symptom of lead poisoning in children is A, headaches, B, weight loss, C, fatigue, D, learning difficulties, and E, growth failure.
D.
Answer is D, learning difficulties. As I told in the figure that the IQ of the children is decreased at low levels of lead. Number 3, a 45-year-old construction worker visits a primary care physician with complaints of feeling more tired than usual lately and having trouble concentrating at work. Of the following, one not a health effect of lead poisoning in adults is A, anemia, B, liver damage, C, developmental delays, D, cardiovascular disease, and E, hypertension.
D, cardiovascular.
No, it is liver damage. Otherwise, it is lead is circulated in all the organs, but liver damage is less common. Mr. XYZ has been feeling increasingly unwell over the past few weeks after his recent employment in gasoline industry. Of the following, the most common symptom of severe lead poisoning in adults is A, joint pain, B, seizures, C, constipation, D, blue lines, and E, memory loss.
B.
Yes, the answer is B. Yes, the answer is B, seizures. A 50-year-old industrial worker visits his doctor for a routine checkup. Of the following, a type of cancer that is most commonly linked to occupational exposure is A, skin cancer, B, blood cancer, C, bladder cancer, D, scrotal cancer, and E, lung cancer.
A.
No, the answer is E, lung cancer. A mother of 2 young children notices strange changes in one of her children after shifting to a newly painted apartment. Of the following, the most striking symptom of lead poisoning in children is A, headaches, B, muscle weakness, C, seizures, D, loss of appetite, and E, fatigue.
Headache?
No, the answer is D, loss of appetite. B. A worker from an industrial facility that uses lead in its production process presents in OPD with multiple complaints. Of the following, one which is not a potential health effect of lead exposure is A, anemia, B, liver damage, C, developmental delays, D, cardiovascular disease, and E, hypertension.
B.
Yes.
Liver damage.
Yes, the answer is B, liver damage. In order to minimize the potential harms caused by lead exposure in children, including developmental delays, learning difficulties, and behavioral problems, CDC warrants initiating public health actions when the blood lead threshold level for children exceeds A 5 micrograms per deciliter, B 10 micrograms per deciliter, C 15 micrograms per deciliter, D 20 micrograms per deciliter, and E 25 micrograms per deciliter.
C.
No, the
B.
answer is B. Yes, the answer is B, as it was shown in the figure. Person XYZ has been working for a construction company for several years and was frequently exposed to asbestos while working on buildings that contained the substance. Despite wearing protective equipment, he is still at risk of inhaling tiny asbestos fibers that could lead to mesothelioma. The latency period for the development of this type of cancer is A 1 to 5 years, B 5 to 10 years, C 10 to 20 years, D 20 to 30 years, and E 30 to 40 years.
D.
Yes, the answer is D. Occupational cancers are caused by the exposure to carcinogens in the workplace. Primary prevention measures aim to eliminate or control exposure to these substances before cancer can develop. One of the following known to be a primary measure to prevent such cancers is A. Regular cancer screenings. B. Using personal protective equipment. C. Developing early warning systems for chemical exposure. D. Implementing engineering controls to reduce exposure. And E. Personal protection.
B.
Yes, the answer is D. Implementing engineering controls to reduce exposure. This is the key of the MCQs. This is the YouTube channel link. Please like and subscribe. And thank you very much.
Thank you very much. Very important topic, Dr. Amisha, that has been covered today about the occupational health. And especially we have seen over the years that the lead exposure has been decreased by having the control on the petrol that is lead free, on certain paints that are again lead free. However, we know that lead exposure especially has a very serious consequences, not only on the health of children and adults, but also on women health. We have also witnessed to the brain, nervous tissue, and convulsions that are related to even coma and death that have been reported after severe lead poisoning. We have seen in Mayo Hospital the children who have survived very severe lead poisoning because they were the resident of Kasur, where a lot of tanneries are in work. And I have witnessed in preventive pediatrics many children who have come with asymmetrical flaccid paralysis because of this poisoning. They were initially being thought that they are cases of polio, but on detailed workup and on further surveillance of the area, especially of the water sources, we have come to the conclusion that these are affected by polio. So these things, they are very important, and the occupational health, especially that is leading to the lead-based paints and lead-based dust, they have been controlled over the years. Yes, there must be a complete ban, but we know that most of the homes that have been built over 1980s, they are still having a very good chances that the lead-based paints have been used. Similarly, we know that petrol, most of the time it is lead-free, but so it was the previous years where there were a lot of lead was in the petrol. Similarly, we have seen the learning difficulties in children at that time, especially irritability, loss of appetite, and weight loss that has caused those advocacy efforts to decrease the lead use in houses, in petrols, in vehicles, etc. And this advocacy effort has been very successful, and now we are having very less use of lead now in 2023. This is very important thing to discuss further about occupational health, how asbestosis and other important things they are affecting human health. Very good effort, and I hope the similar presentations would continue in future too. Thank you very much. This is all from my side. If there is any question, please let me know.
Thank you very much, ma'am.
Thank you. Allah Hafiz.
Allah Hafiz.